Hey guys, this is Dr. Moore with Cumberland Chiropractic and Sports Medicine. Today we're talking about disc injuries, so disc bulges, disc herniations, things like that. The majority of us will experience low back pain in our lives, and disc problems make up a certain portion of that. So today we're talking about the symptoms and causes of disc problems in your low back and our treatment methods for addressing these problems. So if this is you or someone you know, stick around. So when we talk about disc injuries, we're talking about injuries to the discs that rest in between the bones of our spine. The discs act like a shock absorber or a cushion, and you can think of it a lot like a tire. That's the analogy I typically use. A tire has a hard outer surface that's very tough, but inside it's filled with air. The discs in between our spine are filled with gel, right? So when we injure these discs in between our spine, oftentimes it happens with either a bend or a lift. So when we bend forward or bend down, we put a lot of pressure on the back portion of the discs in between the spine, and when we're lifting things, that extra weight adds compression, which can also put our discs at risk for an injury. The symptoms of this, typically you'll either have local pain, so like pretty severe low back pain at the site of the injury, and sometimes you can develop radiating symptoms into the arms or legs that's like tingling, numbness, burning, or just sharp pain. Okay, so we talked a little bit about what a disc injury is. So how do we treat patients that come to our office who we suspect have a disc injury? Well, initially, when a patient comes in with a disc injury, it can be pretty severe pain, right? It's pretty acute. So we have to be very careful about what we do because it might be limited as far as what we can do with the patient that isn't painful. But day one is all about getting a solid diagnosis, right? Confirming that it is a disc problem and finding out which disc is involved. At that point, we want to find a position for the patient that is comfortable, if possible. So, for example, a lot of patients with disc injuries, it's more comfortable for them to be extended, like an arched back position. So we'll send them home with rehab exercises and stretches that put them into that position that can break the cycle of inflammation and irritation happening at their low back. If the patient's not in such acute pain, we can sometimes do flexion distraction. You may have heard of decompression or traction for the low back. It's a therapy similar to that. It stretches the spine long ways and tries to help the disc that's involved recede back to its normal position and alleviate pressure that's being put onto the nerve leaving the back. Other things that we might do day one are laser therapy. Laser therapy can help again with that inflammation process that's happening and help relieve the immediate pain that the patient's experiencing, or we can do therapeutic taping, which can also alleviate some of the pain that the patient's having. Okay, so again with our disc patients, typically their first visit or two, they're in some pretty acute pain, so we may be limited with our therapy options, but as they feel better and we can progress them through our treatment regimen, we can do more and more in ways of what therapy they can tolerate. We can adjust their back, loosening up any restriction in the segments of their spine, which really helps them with the pain and increase their mobility. We can advance their rehab stretches and exercises to increase their range of motion they feel comfortable with, and we can do really picky soft tissue work as far as loosening up any muscle spasms or restrictions they have in those regards. So gradually over the course of about 3 to 6 weeks, the patient feels better and better, and really the last stage of the treatment that we offer in our office is we want to make sure that they're moving well so they don't have this issue again, right? The last thing that we want is to get them feeling better and then send them out to have another disc problem. Because once you have one, it's kind of like a sprained ankle. If once you have one, your likelihood of having low back issues in the future can increase. So we want to send them out making sure that their motion in their low back and their mid back is shared, right? They don't have any tightness or restriction that would cause them to beat up those segments where they have had this injury. We're going to send them home with some exercises and stretches they should do semi-regularly to keep their low back moving well. And of course, if they develop any issues, give us a call as soon as possible so that we can check in on their low back and make sure that it's moving the way it needs to. Okay guys, so this was a little bit of an overview about disc injuries and how we treat them in our office. Again, low back pain is extremely common. Most of us will have it at some point or another, and a certain amount of these are caused by disc injuries. So if you have a disc problem, right, some low back pain or neck pain with radiating sensations into your arms or legs, give us a call. It's our bread and butter. It's what we deal with every day. We'd love to help you with it. So if you like this video, give it a thumbs up. If you know someone who needs to see it that's maybe suffering with this issue, then share it with them. If you have any comments or questions, please leave it with the video. This has been Dr. Moore with Cumberland Chiropractic and Sports Medicine, where we get you better, faster.